6 months after Rhode Island had its first coronavirus case, the state is reporting a record day of testing. The health department says they had 108 new cases out of more than 8,500 tests, which is the most tests done in a single day since the pandemic began. The positivity rate was 1.3%. Unfortunately, the death toll continues to climb. 3 more people with the virus have died. The number of people in the hospital remains relatively flat, though. Today, we got local reaction to the recent changes the CDC made in its testing guidance, changes that have led to confusion and criticism. Eyewitness News reporter Logan Wilber continues our coverage.
As Rhode Island is working to ramp up testing capability, the Centers for Disease Control guidelines say many people may not need a test. The CDC clarifying previous guidelines made earlier this week regarding who needs a coronavirus test. Local doctors share their reactions.
In 20 years of working in medicine, I've never seen the CDC behave like this.
These are concerns to health professionals such as myself.
The CDC changing its stance from recommending a test for anyone in contact with someone COVID positive to those only within 6 feet for more than 15 minutes. Doctors say they're worried these guideline changes come from political pressure.
If you look at our numbers compared to like countries around the world, I think the reason that we are doing so poorly, the reason our infection rates and our death rates are so high is that this has become a politicized thing instead of just being about medicine and healthcare and community.
The Rhode Island Department of Health says it has no intentions of recommending a limit of who is tested in the Ocean State. The DOH tells Eyewitness News, quote, while we always pay close attention to recommendations coming out of the CDC, we are taking a more aggressive approach to testing in Rhode Island.
They have done an incredible job at preparing us, at supporting us through this. So I think our public health leadership and our governmental leadership has just been amazing. And that's one of the reasons that is the predominant reason that Rhode Island's numbers have been so low and that we've done so well.
We have been fortunate in Rhode Island because of the guidance of the governor and the leaders of our healthcare systems to have really strong availability of testing.
And for weeks now, the state and the governor have said increasing testing capability and rapid testing is an important part of reopening our schools. Reporting in Providence, Logan Wilber, Eyewitness News.